So I wanted to introduce our speaker today. We have Carol Merriman. She is the Director of Recovery Plus Services. That's by Centra Care here at St. Cloud. Those of you who might be familiar, maybe even have seen Carol before. And so those of you especially that have your LADC or that are interested in the co-occurring diagnoses or interested in with the addiction component of rehabilitation, this will be a great presenter for you. So I can already see your excitement, so that's awesome. But yeah, she has handouts and is very happy for you guys to ask questions and interact. So please be curious and let her know what you're thinking. So Carol, thank you.
Thanks. Thank you for having me. I'm a very informal presenter. So ask questions, do whatever. I did do some prep. I've been working at Recovery Plus for 22 years. I actually started as an intern and was fortunate as my internship was coming to an end. There was an expansion in one of the programs and I applied for it and got the job, and I have been in many different roles within Recovery Plus, but actually have been there ever since. So it has been for me a wonderful, wonderful experience. When I started, I was looking for an internship. I knew somebody, you know, because I was in a master's program like you guys and I needed an internship. I knew someone who worked at Recovery Plus, who had been instrumental in my going back to school as a non-traditional student. I actually graduated and got my master's degree the same year that my youngest son graduated from high school. So we shared our graduation parties. But so he'd been instrumental, and so I ran into him and I said, you know, you kind of got me into this. Now you have to help me get out. I need an internship. And didn't know much about addictions when I started. Certainly didn't think that was where I was going to stay. I had planned to go on into maybe private practice, something like that. So it was a surprise to me when I stayed. I stayed because I have a passion for the work, a passion for the clients. They're very challenging at times. And as I've been at Recovery Plus, we have done much more dual diagnosis or co-occurring. So it's treating the addiction component and the mental health component at the same time. You can't heal half a person. And it's pretty hard to know, you know, when you're trying to separate those things out. So we really have a very holistic approach. I've been in a number of roles. When I first started, we had something that we called casual. So that meant that they called me when they wanted me to work, and I would go to work. The good thing is that there was enough work, and so I always worked full-time. I became a counselor for a women's group. I became a psychotherapist. I am licensed in the state of Minnesota as a licensed psychologist and as a licensed independent clinical social worker. So eventually I moved from doing the addictions component to doing the mental health component. Had that position for a number of years, then became the clinical coordinator, overseeing the staff, and then a little over 2 years ago became director. We have an average of 350 patients in our various programs. We have 160 staff, and I manage 265 beds. Recovery Plus is an outpatient program, and we have supportive housing. So our folks, we have a house in Sauk Rapids, we have a house near where Toys R Us used to be. Subaru is in there now. And our folks stay in our housing at night if they don't have a safe place to go home to. Lots of people in addictions come from addictive families. And unfortunately, the longer I've been in this business, the larger a population of homeless are. So many times, people stay with us because if they don't stay with us, they have to go back out on the street. And living on the street is not good for anybody's emotional or physical well-being. So we are large, and the important thing when you're a large organization and you treat a lot of patients is to remember that for every patient you work with, no matter how you work with them, this is their life in this moment. I see, like I said, I can see 200 people walking down our halls in one day, but for every one of them, this is the moment in their life where they're trying to make some changes or they're having a struggle. And if you take nothing else away today from what I say, remember to be present every time for the person in front of you, because it is their life and they deserve that. They deserve the best you can be. So in addition to all the wonderful knowledge and skills you're going to bring to your employment, the other important piece is to bring yourself and that empathy and understanding and caring. That happens because nobody goes into this field without that. This is not a field where you're going to get rich. So, you come in because you care and you have some connection and it's something you really want to do. And so I cannot stress how important that is. To listen. I've been doing this now, as I said, for 22 years. I've heard all kinds of things. People's stories from person to person to person aren't so different from what I've heard before, but it is for that person. It's their first time having to go through addiction or any kind of rehab. And so for them, it is life and death in that moment. And they deserve the best of all of us who work in this field. So within our section in Centricare, or the behavioral health section, so we have an inpatient mental health unit for both adults and adolescents. We have a psychiatry department. We have a psychology department. We have something called integrated behavioral health, which is new, and that's where we embed counselors, rehab people, right in the clinic. And you help support the staff and you support the patients coming into the clinic. And then we have partial hospital programs for folks who are struggling with their mental health. We have an adult one, an adolescent, an early adolescent, and then a early childhood one. And then again, it's an all-day program. It's go home at night. They come during the day, and it's at Clara's house. Some people may know that. It's over near the plaza. And we take young people ages 5 through 18 into that program. And it's hard to imagine a 5-year-old with active depression or behavior issues that can't be taken care of at home, but it happens all too often. In our chemical dependency program, we have primary treatment, which is 30 hours a week. So clients are with us all day, 30 hours a week. We do group process. We do educational components. We do grief and loss work. All those things that help the person become a whole person again. Again, as I said earlier, you treat all the parts of their mental health, treat all the parts of their physical health, and treat all the parts of their spiritual health. to try to reach the whole person, give them what they need. We have a halfway house, which is a lower level of care. And that we have 2 of them. We have passages, which is for men and women without children. And then we have Journey Home. We have 86 beds at Journey Home. And it is for moms and kids. 43 of those beds are for moms. The other 43 are for moms to bring their children so that their children can stay with them while they're beginning to heal. That's a unique program. In our primary one, we have moms bring their kids too, and we are the only primary treatment facility in the state of Minnesota where mom can bring kids. So we will get, at either one of those levels of care, we'll get a woman who comes in, has been using drugs and alcohol, needs to go to treatment, and she will come to us while she's pregnant. She can stay with us. She will deliver while she's with us, and then she brings baby back, and baby stays with her all day. So on any given day, we have crying infants in our halls as mom, takes care of them. And we do it because it's important not to separate moms and newborns. That bonding time is very, very important. And mom getting healthy is very important. So the best way to do it is if you can offer both. As baby gets older at 2 months, we do actually at Journey Home have a licensed daycare. So we do daycare for infants, toddlers, preschool, school age, the same as any other daycare. So mom drops children off at daycare in the morning, goes and does her thing, picks them up at the end of the day. They're in the same building, that they get their housing in. So Passages has 48 beds for men, 15 beds for women. Again, a lower level of care. We have a traditional evening outpatient program. We have a residential adolescent program that has 25 beds for adolescents with dual disorders. And then we have 5 school consultants. So we have 5 people who are licensed as LADCs who are out in the various schools doing outreach to the kids in the school. As someone in the school is identified as having problems, that person is right there. Yes?
Do you have anything for like single dads if they have children?
Yes, absolutely. We have visitation on weekends. Our society is still set up so not many men are the custodial parent, though sometimes they are. That's beginning to change. But so if dad's trying to reunite with his children can come on Friday, stay till Sunday. In the summertime, we sometimes do a little more during the week. So it works like any other visitation would work, so that dads can reestablish relationships. Drugs and alcohol take away all of your relationships, and so you have to redo those relationships. So we do that. We also work with our adolescents who might come to us and are either moms or dads or about to become moms and dads. You live in the reality of the world that your clients and patients live in, and that's their reality, and they need us to meet them where they're at and to help them with their reality. If somebody's homeless, you need to attend to. How do you find housing? Where are you going from here? Those kinds of things. We also have, as I said, we're co-occurring, we're dual, so we have psychotherapists on staff. My training, I'm actually a graduate from SCSU. I got my undergrad and my master's degree here in psychology. My area of expertise when I carried a full caseload and still now is trauma work. So survivors of abuse, neglect, and then the personality issues that come with that and those kinds of things. So that's my area of expertise, and many of our adults who come to treatment, men and women, have trauma histories, and so it's very important for us to be in tune with that. We have an arts program, because some people don't like to talk, and they can't really express themselves well in a group. So we have an arts program where we have artists from the community come in so people can express themselves by painting, by writing poetry, you know. We do some music therapy. We have acupuncture. We do a wide gamut of things to try to help people with all of their physical and mental health needs. Probably one of the areas that I really want to touch on is the least favorite area for anybody who goes into this work, and that's documentation. You know, nobody goes into this job that I've ever met because they want to sit at a desk and work on a computer and write out progress notes, do anything like that. And it's vitally important. It's how you show your patient's progress. It is how that person continues to get your services. And at the end of the day, it's how whatever agency you work with gets paid. And, well, our mission is very important. If we don't get paid, we don't keep the lights on or the doors open, so you have to get paid too. And so I think one of the things, at least that I find when I work with interns, is that there isn't as much training in documentation. And how important it is, and the reality of how much time it takes. I can speak to the LADC licensure and being licensed by the state of Minnesota as a chemical dependency clinic. We have a rule, we have to dedicate 25% of an LADC's weekly hours to documentation. And I'll be honest with you, you can't get it done in 25% of your time. There's too much. And it's, you know, you've got to document about this, and you've got to have it in this format, and you need these things, and you know, you've got to say what time you started your interaction. So if you met with a patient for 45 minutes, what time did it start? What time did it end? Did they participate? What was their reaction to whatever you tried to do for them or with them? And that takes some time. You get faster at it after a while, but it is one of the things, particularly for folks who are new, in any area where you have to document. The question is always, well, what am I supposed to put in there, and what do I leave out? And if you're newer in the field, you tend to be afraid to leave anything out, so you put everything in, and it takes even longer. But it is important to learn as much as you can about how to do documentation, you know, what you need, why you need it. And at the end of the day, you know, I still don't like doing documentation. I'd much rather be talking to you or talking to a patient or, you know, doing those things. But it's a real part of what we all do. So, you know, to think about that, to think about the assessment you do with a patient. Yes?
So I hear you about documentation and all of that's for billing and keeping the lights on. Do you have any resources you could recommend as far as, or is it just a kind of learn on the job? Or?
Some of it's learn on the job. Some of it, it's my hope you'll learn in school, that you'll learn as part of your classes. We do a lot of work with our interns who come to us about documentation because we know that once you're on the job.